Fry, our CEO of Cortex. I'm with our head of business development of our prostate division, Brittany Hunt. We wanted just to do a couple rapid fire questions as we are launching our prostate product into the market. I mean, obviously many people know us for NeuroQuant, but here to kind of talk to Brittany, you've been a part of the prostate journey for the last several years, right?
I have. It's been quite a long time coming. OnQ Prostate actually first got FDA clearance in 2019. We've been working with a small number of select KOL sites to really develop the clinical use cases and validate the utility. And now we're really ready for prime time. So kind of relaunching it, in a sense, into the market through Cortex.
Tell us some of the benefits of our OnQ Prostate product.
Sure. So OnQ Prostate is the only product that uses restriction spectrum imaging, or RSI. It's really an advanced diffusion MRI technique that helps us better separate out the different sources of diffusion signal and really focus on what's coming from true intracellular restricted diffusion, kind of as a hallmark characteristic for aggressive cancer. So the main benefits of the technology are really the improved conspicuity that it provides. It really lights up the tumors and makes it really easy to see and diagnose, and the added specificity as well. One of the inherent limitations of standard MRI is lack of specificity, so you might get signal from normal tissue or BPH or something that makes it hard to distinguish tumor from non-tumor and kind of blurs everything together. So when you have this more advanced tissue microstructure modeling, we can really, again, kind of focus in on what signal you're looking for and attenuate what you're not looking for.
What would you say to someone that says, I'm already, used to using the PIRADS method and we're happy with what we have? What would you say to that question?
I think that there's inherent limitations that are well documented in the literature and well recognized in the field, where people know that PIRADS isn't perfect. They know that MPMRI isn't perfect. And it's not designed to replace any of those things necessarily, but can be used in conjunction to really do it better. So I think that MPMRI and PIRADS is really the starting point for prostate MRI. And we're saying, hey, how do we take that and optimize it and do better now that we've noted some of the limitations? And I think that we really do a great job of directly addressing some of the issues with the standard imaging and really leveraging the biophysics to do a better job finding what we're looking for.
How would you say urologists can benefit from our technology, right? I mean, we talked a lot about the imaging side and the diagnosis and helping to look at that, but how can urologists benefit from our technology?
I'm really excited to answer that question. We started in radiology because, Cortex, kind of that's our home turf is radiology and imaging. But now we're really seeing a lot of demand from the referring market, where referring physicians need to actually interact with the images in ways that they didn't before. They used to send off to radiologists and then they'd get back a report, and then the urologist would go and do their systematic biopsy, not really actually using the imaging results themselves. Versus now we have landmark clinical trials that show, hey, we should actually be doing MRI-guided biopsies and therapies. They need to interact with the images and use it in their fusion platforms to increases the transparency, where you don't have to be an expert radiologist to see the lesion. Really help bridge the gaps between radiology, referring physicians, and patients. If you're a patient and you want to understand, why you may be potentially undergoing an invasive procedure, I think the physicians, they don't want to overdo procedures or, run the risk of missing cancers. So it's really just been a delicate balance of trying to make sure that you catch the right cancers, but you don't do too many unnecessary procedures.
Thank you for coming on and sharing what we're doing in the prostate space. We're incredibly excited about it. Thank you.
Thank you, Kyle. Thank you.